see if everybody else is here. You'll see me look off to the side a little bit just because I'm monitoring some things over here. So we'll wait for a few people to get in here. Everybody had an okay day? You guys good? Let's just talk like
yeah.
So far, so good.
Yeah, good day. Awesome. Was it pretty full for all of you?
Yeah, actually.
Oh, Erika, I can't quite make your sound out. Say it again.
I said we're actually transplanting tonight.
Oh, wow.
Actually.
Really?
Oh, good.
Yeah.
Awesome. Yeah.
And all my patients called me via phone with medication refill requests. So,
oh, geez. Okay.
I didn't see anybody today, but that was all good.
Okay. Got it. All right.
Yeah.
All right. Well, we're going to get started. We have one viewer. It will be more. I know that. Hey, everybody. Hey, it's your girl, Rajette Speaks with Narrative Shifts, where we are redefining and reframing the narratives that go out about us. Today on our show, really, really thrilled about this panel that we have tonight. As you guys know, a lot of you who've been keeping up with me know that I have an affinity toward the medical field. I'm kind of a geek when it comes to science. I've been kind of geeked out since I was young. So to have this panel with me tonight is incredibly exciting. It's going to be super informative, and I'm just really pleased and excited and favored really to be in the midst of such educated individuals. And so tonight I'm going to introduce to you Dr. Silas Norman. I will be introducing Nikeyia Davis as well as Erika Dudley. So Dr. Silas, welcome to the show. Thank you for being here. If you could tell me a little bit about yourself and say hey to the audience, that would be great.
Wonderful. Good evening. Thank you for having me. Wonderful to be on. So I am a native of Detroit, and I'm currently working as a kidney transplant physician. I originally went into medicine really because I grew up on the west side of Detroit, and I had this idea that I was going to take care of people in the community with diabetes and high blood pressure. And, you know, at 15, I'm sure that I didn't know what I was talking about. And, you know, but that's what I thought I was going to do. You know, and then I ended up getting into nephrology when really, as I got through medical training, really realized the burden of kidney disease in our community. And of course, you know, found it very interesting. And then, you know, as that progressed, ended up meeting one of my research mentors who was doing transplant himself. And so that brought me into the transplant realm. And I've had the opportunity for about 20 years now to work in transplant. And I think we just, you know, have a great opportunity to reach out to people, help the community. And I think as we're here, I think really see transformative change, you know, when we're able to touch people with transplant.
Wow, that's a beautiful just history of your experience. Thank you for sharing that. Let's go with Erika Dudley next. Tell us a little bit about yourself. I have some questions for everybody.
Okay. Oh, you do? Okay. Hi, everyone. My name is Erika Dudley, and I have been nursing for 30 years. 20 of those years I have been in leadership. In third grade, I knew I wanted to be a nurse. So there's that. And what led me to transplant was just actually some conversations with an old colleague of mine. I was actually, my background is in neurosurgery. And I would see transplant on the side of pre-procurement or pre-organ donation, and just found it, you know, significantly interesting. You know, being in the African-American community, like one of the biggest things for us is kidney disease. I have it in my family, and, you know, you see the repercussions of it. And so being able to be in transplant, you know, and see kidney disease and, you know, all of the things that go along with it. And then us being able to offer the gift of life through donation is something that is really special to me.
That's awesome. Thank you. And then Nikeyia, if you could tell us a little bit about yourself and how you got into the field as well, that would be wonderful.
Okay, my name is Nikita Davis. I'm a registered nurse. I'm a certified nephrology nurse working in an outpatient dialysis clinic in the Metro Detroit area. I've been in nephrology for the past 21 years. I started off as a dialysis technician, actually, and I just completed my master's in nursing with a focus in adult gero nurse practitioner. So I'm just waiting to take my boards. I plan on staying in nephrology as well. I have experience working with patients in a chronic outpatient dialysis setting. That's when the patients come in average 3 times a week. I've worked with patients with chronic kidney disease in a clinic that's not yet on dialysis. I work with patients in a hospital in an acute dialysis setting. And currently I teach patients how to do their own dialysis at home. I teach them how to do peritoneal dialysis and home hemodialysis. And when people ask me why did I get nephrology, I don't think I chose nephrology. I think nephrology chose me because I don't like anything else. If I had to choose something else besides nephrology, maybe cardiology, but this is what I do. So like Erika said, kidney disease runs in her family. It runs in my family too. As people know me, know that my sister had a kidney and pancreas transplant about 3 years ago. So kidney is my thing.
Got you. Thank you for that. You go by the kidney nurse, so they're seeing the kidney nurse. Tell us a little bit about what that is, or why. Because every nurse that functions with kidneys, anyone could call the kidney nurse. Why are you the kidney nurse? Or
I am the kidney nurse because my goal is to really educate our community on kidney disease prevention. So as Dr. Silas, stated, high blood pressure and diabetes are 2 of the main causes of kidney disease. So I really want to educate the public on some disease processes that they can possibly control to prevent progression, of kidney disease or, delaying.
Got you. Okay. Thank you for that. Just listening, I'm hearing about dialysis. Obviously, we know that that's a thing, and I know you're more sort of hands-on in that space, Nikeyia. But if any of the 3 of you can answer this, I was just thinking about the context of COVID-19. Now, this conversation is not going to be COVID-driven, right? But in terms of COVID-19 and just your ability to access your patients when everything kind of just went south, how challenging was that for you, or what kind of adjustments did you have to make? Any one of you or all of you?
For us in a dialysis clinic, it was super challenging, just the way the dialysis clinic is set up. So it was its own little hotspot before we, tried to make changes with the chair arrangements. And it's not like our patients can stay home. This is life-sustaining treatment, so they have to come. So we just had to make adjustments as far as how they sat in the lobby, how they sat on the treatment. And so that's the inpatient side. So for me, with my home patients, I limited their interactions with coming into the clinic. So at that time, we were not on telemedicine, video visits. We really, really had to implement that. That was a challenge with some of our non-technical, patients. And I had patients from 20 years old to like 86 years old. So that whole piece was different. And, it was a challenge, but we got through it. We're still, working through it to make sure our patients stay safe and healthy.
That's awesome. Thank you. I believe, Dr. Silas, I heard you say that you've been in the field 20 years in kidney health. Is that what I heard? Okay, that's awesome. That's a great, wonderful run so far. Keep running. I would like to know, in terms of just Black folks in this space, in the professional space, right? So 20 years ago, were there a significant amount of us represented in these professional environments in terms of nephrology?
So the simple answer is no. I think as many people know, African Americans make up overall about 2% of all the physicians. Actually, 100 years ago when hospital systems were segregated, there were actually more Black physicians proportionally than there are now. African American physicians are more commonly in a number of the primary care fields where we're very much needed. But that means that when you look at specialties like nephrology, there's even less representation overall. I think that Eric and I could probably name every nephrologist in Michigan who's Black. and know them all. And so I think because there's few of us, on the one hand, it means that we're a close community, the other challenge, though, it means that there's few of us. We know that there's several studies that show that African Americans get better care overall when they have Black physicians, as do some other people. And so as we think about making sure that our community has access to the best care, one of the limitations is that is the representation of the physicians and the nurses and other providers that take care of them.
Okay, thank you. So in terms of that access to the best care, our patients, I mean, anyone who's not a physician or a nurse, in terms of being the patient, what are your thoughts about patient advocacy? Because in a situation where maybe the representation is less, or we feel maybe like something is not quite jiving right, and we want to kind of ask a little bit more, we have questions we don't quite understand, or maybe because of what you just shared in terms of that representation, the practitioner might not have some knowledge, right, culturally about some things. In terms of the patient advocacy side, right? So I'm the patient and I'm kind of just confused. I know I've got some things going on with my kidneys. They just told me something's going on. How do you advocate for yourself as a patient when you do see maybe some disparities that are going on, maybe right in front of you? Or, if I'm in the ER and something's happening, or I'm at the dialysis appointment and I see that, how do you recommend that we advocate for ourselves? What does that look like?
Sure. No, I think that's a tremendous question. And I think, because at the end of the day, your health matters more to you than anybody else. And Absolutely. So I think it's incumbent upon us to be stewards of our own health and be advocates for ourselves and make sure the best we can that we're getting the care, the treatment that we deserve. One of the parts of that is then it's up to us to make sure that we're well educated about our medical condition, our disease, and what the best care is. That's not always easy, but I think it's, at the end of the day, if we're going to ideally prevent having kidney disease, if we're going to slow down that progression, if we're going to make sure that we have the best longevity, we really have to know, what the best care is out there, what the best recommendations are, so that we can go to our doctor, and say, how come I'm not on this medicine? How come, you told me my blood pressure is okay, but I checked my blood pressure and, it's supposed to be lower. I think you're supposed to refer me, for a kidney transplant evaluation right now, these kind of things, I think, if we think about our kids in school, right, we would have, I think, no problem going to the school and saying, this is what I expect for my child, this is not happening, this needs to happen. And I think, same way for our health, and I think programs like this are terrific opportunities to help people educate themselves and learn what they don't know, and help provide some resources to people.
Thank you.
Yeah. Back off that. So Michigan is now demanding implicit bias training for all healthcare professionals. So,
wow, good.
Professionals, we need to put our biases aside because everybody has them, and you may not realize that you have them. So you can't, look at somebody and say, hey, they're not, controlling their blood pressure, they're not eating right, and this, that, and the other. They may not be doing those things, but why? Is it their environment they're living in? Can they afford to do these things? People are choosing between filling their prescription medications or keeping food on the table, or keeping lights on, or heating gas. So we have to really check our own selves too, and especially when you're dealing with a different culture of people.
That's good. Thank you. Erika, did you want to add anything to that?
No, well, maybe a little bit. I think that the training is absolutely imperative, and I am excited to see this being rolled out and being mandated. I know when I worked at the University of Michigan, we had started this work quite a few years ago, and really taking a look at how many African Americans and minorities were in leadership, were in all phases of the discipline, and really having someone from the diversity division come in and show that unconscious bias is real, and like showed us with all of it, because we as African Americans or minorities, we see it, but we are the only ones that see it. So being able to, have that highlighted, I think is going to be, tremendous for the community. And then it gives us a little more power too, to hold our peers accountable.
That's great. When does this training begin, and how long is it going?
Well, it's going to be a requirement for us to renew our, license. So it's going to be rolling out soon. I actually sat on the subgroup committee with the state of Michigan through the American Nurses Association to help formulate the education piece. So
okay, excellent.
It's open for public comment now in the legislation.
That's really good. That's really encouraging to hear from this side, from the patient side. That's really exciting. So all of you, well, Dr. Silas, you don't know, we're not going to make this about me, but, I just spent a couple of months kind of dealing with some health challenges that were just crazy and out of the blue and just really randomly seeming, right? And I tend to be someone who does deep dive into all of the research. I'm going to the journals, I'm checking because I need to know what's going on with my body, right? Mm-hmm. And I love that you mentioned it and in the way that you did, highlighting the fact that if this was our kid, if we are going to the school, it's like, no, I need this, I need this, I need this. We have all these demands. We have a list of what we believe to be the best criteria, right, to best support our children. And yet we don't necessarily use that same energy with ourselves, right? And I love that you shared it the way that you did, coming from, the position of a doctor, and so it's interesting because over here on this side, we want to be able to advocate. And sometimes I think there's a bit of intimidation, perhaps, right, from the patient side, because maybe we aren't as knowledgeable as we need to be. And so in terms of seeking to get more education, to become more educated about our bodies or the scope of what we may be dealing with, I know you said, programs like this, these are great. What are some other ways in which, community members can actually educate themselves? Because what happens is there's a stigma sometimes if we go look it up, because that's what we do. We go on Google, right? And we look up things and we may come to the doctor with a whole list of, I saw this on WebMD, I saw this on such and such, because that's what happens on the patient side, right? I think there's a bit of a, I don't know, at times I've seen the condescension, what am I saying? What word am I saying? Condescending nature of, some clinicians who are like, okay, no, like stop doing that. But, what do you recommend, for those who have maybe experienced that?
So I think, I'll answer maybe two parts. Okay. I think that there's certainly a number of great sites out there that are directed towards patients. So things like MOTEP's site, Gift of Life, National Kidney Foundation of Michigan, the American Kidney Fund, that are patient-centered and at least an entry into getting good information and reliable information, with good links. And I think that's a first step. Okay. And then I think the second part is building on what you just said, is people remembering that at the end of the day, the care is about them. And so, I certainly have a number of patients who are good at advocating for themselves. They'll come into my 30-minute visit, and they will sit down with that list. Yes. And they are unfazed by the fact that list is clearly more than 30 minutes. Yes. But they say, look, I've got 15 questions and, you're going to answer all 15 questions. Good. We can be here till noon. And at the end of the day works and they get what they need to take care of themselves. So I think in some sense, people don't need to wear that. I think it's a 30-minute visit, but if you think it's a 45-minute visit, then, we're going to have a 45-minute visit if that's what we need. Because, and I think, even though some physicians may be off-put by a patient who asks a lot of questions or makes you really explain what you're doing and so forth, you really like that patient. That's an engaged patient. That's a patient who you can make a plan with and have follow through. So I think people shouldn't be at all intimidated. I mean, they're paying us, so. People should get what they need, from their doctors. Ask those questions. We laugh. People bring up stuff. And you have a good relationship with them. You can just laugh when they bring up something that's a little off the wall. But
Right.
you're laughing with respect as you then move on to say, okay, like I like turmeric too, but all right now, kind of thing. So.
I love that answer. Thank you. Gosh. Okay. I'm trying to see which way I want to go here. So you mentioned gift of life. And so let's let that segue there a little bit naturally. So I learned about gift of life, I guess, I want to say about 7 years ago or so. I wasn't familiar with it. I've always been a pretty solid advocate for or proponent, I guess, of like organ donation, right? Like I'm here for it. And I learned about gift of life, I think through Erika, possibly. I think maybe it was the first introduction there. But a dear friend of mine who was a mentor of mine, he passed away several years ago. And that was my first sort of introduction to Gift of Life as the organization, because I was talking to his wife at the time. And so she was just kind of working through that and sharing, and she still shares the stories, and it's beautiful. And that was my first introduction to it. Can you guys tell me a little bit more about Gift of Life? I'm sure there are people who have no idea what it is, and I really want to spotlight that, especially with March coming up and everything.
You gonna go, Silas, or you want me to go?
Go ahead, Erika.
So Gift of Life is what we call an organ procurement organization. And so Gift of Life works with the transplant centers and with our regulatory body to take a look at all of the patients that are on the wait list, that local, regional, and national. And so every 9 minutes, someone is added to the wait list, right? And over 100,000 folks are on the wait list for kidney transplant alone, and about 30% of those are African American. But Gift of Life has been really interested in pushing even COVID policies and conversations, because COVID is something that has been, has hit us pretty hard. And I think that there's an article that has been circulating about a young woman who actually got a set of lungs. And so, when the deal went down, she died from COVID from the organ transplant. But Gift of Life actually has been instrumental in getting folks added to the wait list. A lot of work was done with that with the Secretary of State. And got a little hit with COVID because of removing extra people from the centers, but still are advocates for for donation. And actually, the tagline is honoring the legacy of a person through the gift of donation. And so Gift of Life has really worked with transplant centers to go out in the community and just kind of tell the people about organ donation, especially, in our community. We have minority organ tissue transplant education program. And so Silas actually set on that board. And so we have focus groups within the community and just kind of talk about some of the myths for organ donation, because that's, it's really real in the African American community. And, we use a lot of the organs. And so being able to have those candid, transparent conversations to kind of get us comfortable with, when you come into the hospital, we're going to do everything that we can. Now, if you lead toward brain death or, there is that withdrawal, then these are options for you to be able to, give the gift of life to someone else. Because for solid organ, one person can, save 8 lives. And so it's been amazing working with Gift of Life.
I'm sorry. Thank you. I heard you say that we talk in the African American community quite a bit about these, or at MOTEP, they're the myths of organ donations, right? And so can you speak more about that? Because I know personally, when I was growing up, I was a child, and I remember saying, "Oh, I want to give my organs. I want to be able to donate my organs." When I was younger, and my parents were like, "Hey, don't do that," And so I remember it just kind of being a hard stop, and I didn't understand, because to me as a child, I'm like, this makes sense to me, right? And I realized later, as I grew, that there was so much stigma on that, and to a point, rightfully so, right?
Yeah.
But how do you combat that? Like, how do you actually talk to people and get them, to a place of accepting the fact that, like, yeah, okay, I should donate my organs, or I can, and obviously it's a decision, for everyone. Each decision is going to be different, but how do you actually sort of, I guess, lower that guard a bit, right, as it pertains to that? Eric, go.
So it's really just being in the community, and it's having those, active, small group conversations, and actually, this actual cup, it is the gift of life, and there's no tap. So we did like a lot of work in the community with the minorities, and so we called them Let's Talk, and so it's really we're coming to the table. Talk to us about, your ideas of organ transplantation, and giving them an opportunity to just kind of say, like, we don't trust it, we don't, whatever, and then taking it piece by piece, right? And really showing them, okay, so this truly is what's happening, right? You give them the opportunity to, make the decision, but our role is to really get out there and educate them and show them that we care, right? And so it's not just, so really the biggest thing is not just being transactional, but it's being relational. And we know that in the African American community and in the minority community, we're relational people. You can't just come in and,
Right.
and say, hey, we provided this service. They want to know, can you connect with us, right? And so we have to connect with their heart, and their soul. And so that's what, these little focus groups do. And it decreases or just kind of like gives them an opportunity to just kind of relax and be themselves, to say, how do we have this conversation? And it's one by one, right? I can have a conversation with my family or my friends, because I still have some friends that are like, So every conversation, it's little by little.
Okay. So that community piece is so huge, and we know that obviously within the community. I think that's really good. How often do those focus groups go on with Gift?
Every couple of months, Silas. You can probably answer that more, because I kind of came in the middle of it. But we did a huge run with ad campaigns and like little commercials.
Okay.
And so it's been good. I think that we're also having some conversations about it for this year as well. How do we, remain connected to the community? We go into schools. So it's a lot of being done. Yeah. I don't know if Silas wants to add to that.
I would just know that was wonderful. And, I would just add that, as Erika said, it highlights the importance of representation. You have to have a good messenger is a good messenger. But, this is about relationships. It's about trust. And so, people in the community need to see, people that they trust, people from the community, to deliver these messages, to feel comfortable asking the question about some of these myths, about some of the concerns related to donation, related to transplantation. One of the, with one of these efforts, this Let's Talk was sort of this a matter of faith, which was a video put together that brought together a number of the faith leaders in the community, talking about organ donation, highlighting that it's okay and the reasons. And that's very powerful, because you have people who people trust. And so as they deliver that message, it perhaps opens people up to that possibility. And I think people want to do the right thing. And I think we're in it all the time. So I think it's easy for us to forget sometimes that we appreciate the epidemic of kidney disease that's going on. And I think as people learn about that and hear about that, and as we said, I think all of us in our families, among our friends, among our associations, we all know people who, whether we know it or not, have kidney disease, are waiting for transplants, have had a transplant. And I think once we're aware of that, then in some sense that donation message, becomes easier.
That's good. Thank you. In terms of, let's go to COVID real quick. We're going to switch gears here. In terms of COVID, because I heard Erika mention the article, and I saw that article, and it kind of freaked me out the other day about the lung transplant patient who, like post-mortem, or no, not post-mortem, but mortem, right? Was it post-mortem that she infected about 11 people, I think it was, right? It was the surgeon and then 10 members of the staff, I believe I read. Is that correct?
Well, that was intra. From my understanding, it was during the transplant, right?
Okay.
So not post-mortem.
Right, so I misspoke. Sorry about that. Thank you. So during the transplant that happened, and I'm curious to know, and obviously, that's a anomaly or whatever we want to call it, right? They still need to figure out what's going on with that, of course, through, research and, just checking everybody that's coming in. But in terms of kidney health specifically, have you guys seen an impact directly on the kidneys as it pertains to COVID-19? Any of you?
So in my setting, we had, especially in the beginning of the pandemic, a lot of the acute kidney injury patients who needed dialysis for a few months. Some people recovered, some people did not. Some people had no kidney disease prior to catching COVID and then, going into acute kidney injury. Some patients did have chronic kidney disease, and this kind of put them over. Maybe if they didn't catch COVID, they wouldn't be on dialysis as soon as they were. So this kind of put, a few patients over. So it was just a lot of changes, a lot of, in the beginning, they were running out of workers to do dialysis because of how the blood clots and everything. It was clotting off the dialysis machines. They were running out of supplies. It was a big deal in the very beginning.
Gosh, wow. I'm just taking that in a little bit. That's
And we had to have a separate unit to dialyze the COVID patients because, once again, our patients still need treatment, so we can't turn them away. So we had a separate unit set up for patients who had COVID that needed treatment. So it was a big thing.
That had to be really difficult, especially because it was so new. And so you didn't really know what you were up against. So it's trying to adjust. Right. You're trying to adjust and adapt and have no idea what this is. It's like trying to grab water in your hands, right? Like barehanded. That's
exactly. And you're trying not to catch it, to take it home to your family, and every day the CDC we're changing the rules and the guidelines. So today we're doing this, and then 2 hours later we're like a memo, from our healthcare system, like, okay, we're doing this now. You're like, oh my goodness. So as the people know, I had contracted COVID from a patient at work. And so that was a big thing.
I'm thinking about the mental health naturally. That's my bent of the three of you as all of this has been going on. And so as I'm hearing, Nikeyia, and I know she's on the front lines a lot, more kind of in the trenches, right? But I know all of you are impacted so greatly, by everything. And we are, about a year, I think, right, into this thing. And I think they marked it as a year today. And so obviously when a year has gone, we've become, I don't want to say desensitized, but we kind of have a bit in terms of just people are dying every day. We know that people are dying every day. We're still, needing to adapt and adjust the way we do naturally. But I think about just the toll that may have taken on the three of you in the beginnings, right? And how have you overcome that? Because of course you have your families, right? And Nikeyia, I mean, you contracted it and went home, and you have family. And I know, personally, I was able to, kind of track what was going on with you. And so, it was beautiful to see you press through that, be able to get through it, be on the other side of that thing, and be strong and be in this space and still rocking out things and wonderful, making wonderful strides and accomplishments. But how did you guys stay steady? Like what, I'm just curious because, we're human, right? And you guys are superheroes to me. And I just want to know how you guys, keep it steady mentally. How did you guys deal with that in the beginnings? Let's go with Erika and then Dr. Silas and then Nikeyia.
I think for me, we're on the front lines, but not necessarily on the front lines because we're dealing with pre and post. So we have a lot of our kiddos, though, that when they come into the hospital, they don't leave until transplant. And so it was really, even though we had to push through the fact of we still need to be, at work because we still need to care for these people. But the thing that we found that gave us the most peace and really some grace is the fact that we were just making sure that we were kind to one another. We were visible to each other. We would do debriefings and, and of course it changes, right? Because then everything goes to Zoom meetings or team meetings, or you get a big conference room, and you're, 1,000, miles apart. But, as long as we were able to stay connected and really just kind of work through the process, we kept our patient first. How do we, keep these patients safe, whether they're coming into clinic or, how many times do we have to get them tested because they're in the hospital? So just being busy with trying to make sure that, our patients were good, the process that we were putting in place to keep them safe. And then also just taking care of ourselves. We, did scheduling to where, you work today, I'm at home working. And so just really being, flexible and pliable with each other. And then just a lot of extending of grace.
That's really good. I'm glad to know that you guys were supportive like that in that environment. Everybody has so much going on. And we know that, it's cliche, but hurting people hurt people, right? And so people are grieving through this whole process and everyone grieves so differently. And so, I'm glad to know that you guys had those supports in place and we're definitely exercising that the way that you were. Dr. Silas, what was that experience like for you?
Yeah, so similarly, certainly, on a personal level, in the first month or two of the pandemic, you're anxious going to work because, you don't know and, trying to figure out when you get home and, you're taking off your clothes and, the garage and running and doing all kind of stuff. And my keyboard didn't work because there was so much bleach on it from cleaning and these kind of things.
Yeah.
But like Erika said, our team came together, our leadership team, and we were, working hard, but came together, as a team, supported one another through it, leaned on the family. And really, I think exactly as Erika said, kept the patients first, realized that this is what we do and this is what we need to be doing. And we can't just not try to help people because, we just have to work through that and realize that the important thing is that we're still helping patients, and we did, and made the changes we needed to make, and just worked it out.
That's good. Thank you. Nikeyia, excuse me.
So for me, kind of the same thing. I didn't have the option to work at home because I had to take care of, patients. It was a lot of anxiety because every day you went to work, you're thinking, is this the day I'm going to catch COVID? And so that was tough. You didn't know who had it. So one day Mr. Jones is here, tomorrow he has COVID. So you're like, oh my goodness, was I taking care of him? What was going on? What happened? Wow. And for us, because I'm in a dialysis unit, we're seeing the same patients for years. Every Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. So you know these patients, you have a relationship with them, and then they pass away suddenly because of, COVID. And so when people went out with COVID, you're like, are they going to come back? They got a lot of stuff going on with them, besides kidney disease. A lot of our patients have diabetes, high blood pressures, heart disease, a lot of different stuff going on. So are you ever going to see them again? And then it was mentally draining on our patients because maybe that was their neighbor, that they sat next to for 5 years, and now they're gone, So, it was just a lot. And then when I contracted COVID, I'm a nurse, and I'm like, okay, is this the day I'm going to the hospital? What's going on? So I'm checking, my oxygen levels. I'm listening to my own lungs, like, I'm making sure I'm walking around. I can't walk around the whole house because I don't want to my whole family. So I was like quarantined in a room with my food, slid up under the door. Days, and then, at one point I had a fever for 10 days straight, and I'm like, am I gonna make it? So it was crazy. I never was in any, respiratory distress, so I was still, like thinking, like, this is terrible. So I can't imagine having other things when people have respiratory distress or had to go into the hospital. It's a lot, and I've always said that a lot of us are probably going to have some type of PTSD, after this. And I didn't lose any coworkers, but a lot of people, in my facility, we took turns having it. Like 5 people would be off at a time, and then you didn't know if they were going to come back. I know people who did lose coworkers, and just the whole thing about having COVID and surviving. That's a whole another piece. Is like, okay, such and such died, and you have a lot of survivor's remorse. It's like, well, I didn't die, or I wasn't that sick. I was sick, for sure, but I wasn't hospital sick, So you think about these, things that, so it is taxing on your mental health for sure.
Do you feel like you're fully over it? Like, do you have lingering symptoms or anything that's been going on with you? If you feel like
I'm not having any symptoms. I do have a fast, heartbeat that I don't think I had before. So I would like to see, internally what's going on with my body, because a lot of people have some things going on that they didn't know.
Sure.
Like, scarring of the lungs. They may not have any difficulty breathing or anything, now, but they have some damage. A lot of people are having heart damage who didn't know. A lot of those basketball players, a couple of them had passed out on the court, and then they had COVID like earlier in the summer, and they found out that they had some damage to their heart done. So I would like to see internally what's going on, with me. And then you never know how it's going to affect you in the long haul. You don't know what it seems like COVID affects every organ in your body. So heart, lungs, kidneys, some people had amputations, strokes, just different things, clots, and it's like a multi-system disease. It just doesn't affect the lungs. It affects a lot of things. And then, as you may know, I had, lost my taste and smell for months.
Right. Yeah. A long time. Yeah.
Other neurological damage was done for months. I didn't have it like 5 or 6 months. I'm like, is this ever going to come back? So,
you had terrible headaches too, right?
What was that?
You had terrible headache.
Yeah, right.
Oh yeah. COVID headache is like somebody peeling the layers of your brain back. So, but that was just during and not afterwards, but just during when I had it. But the taste or smell, that was a lingering effect. And I was thinking, and then I felt selfish to even complain about that. I'm like, some people died, and and you're complaining that you can't taste or smell. So it's a whole mental health piece for sure.
Wow. Well, I really appreciate you guys sharing and being so authentic in that and transparent in that with that information. So thank you. Nikeyia, I'm coming back to you because you actually just had an article. You had an article published in a magazine. Let me pull up the title here. So you were featured in the Future of Nursing. And you had an article where you were discussing the question of scientific versus bias medicine as it pertains to kidney function and race, which I was like, okay, this is great. Come on with it. Can you tell us a little bit about why you wrote that article, right? Like what was the catalyst for the article? And then talk to us about it a little bit. Thanks.
So that's the new buzz in kidney world these days, is removing the race multiplier when we estimate the kidney function of African Americans. So the conversation was sparked by medical students actually a few years ago. It addresses how race is used to impact our medical care. In this case, we're talking about kidney disease, which impacts medication usage, dosing, treatment, and delayed referral to transplant. Actually, for Blacks. So it really suggests that Blacks are biologically different from other races, because they only differentiate between Black and non-Black, no other race, So other biases in medicine have been known in the past, such as Blacks have a higher pain tolerance, that Blacks have thicker skin than whites, and then that our blood clots more, quickly. So this is something that's being in the works with the American Society of Nephrology and National Kidney Foundation. They develop a task force, and they're addressing, looking at that calculation again, because what it does is increases the kidney function by 16% in Black people. So, like for instance, we talked about transplant a lot here. So when your kidney function is less than 20%, you can be referred to transplant. But if you have inflation of your kidney function, and then you're being delayed for that. And the same, like I said, with medication, some medications you're not supposed to take. Sometimes your dosing is supposed to be different when you have a decline in kidney function. So my question was, who is Black? Who is considered Black? Are we looking at skin color Black? Are we looking at ancestry being Black? What do we do with biracial individuals? Like, how are these things, being determined, and how would that impact our culture if they remove the, multiplier too? And so they say that we will have an increase of incidence and prevalence in kidney disease in the Black community if they remove the multiplier, because more people will be staged more advanced, but we have the two main causes of kidney disease, high blood pressure and diabetes, in our culture as well. So that's the whole thing of the kidney nurses try to prevent, some of these things. And early signs of kidney disease, they don't have any symptoms. Early signs of high blood pressure don't have symptoms. And by the time you land up in the hospital, you have some end organ damage, and you're in stage 3 or 4 kidney disease, and you had no idea. So,
wow, that's brilliant. Thank you. I love that. Erika, you were getting excited about that. I could tell. Was there anything you wanted to add or just comment?
No, I mean, she's exactly right. And it's got to be removed, because we are we're no better for it, right, to have it. So it's good work that's going on.
It really sounds like it.
Yeah.
So you were talking about this delayed referral for African Americans, and so so okay. Let's see if I can get these these statements out, because you were talking about the multiplier, and because I'm not in the field, I'm just listening. I'm trying to digest and get it right, and give it back to you. So the multiplier, obviously this is the biased setup that's in place, right? And so when I see or hear you say delayed referral for African Americans, it's being delayed because of those factors. Is that what I'm hearing you say?
Right, because the multiplier is there, is saying that your kidney function is higher than maybe it really is. Who knows? And there's other things that they can use, that they're looking to use to really estimate the kidney function.
Gotcha.
But the current formula that they're using now, they're looking to change that.
So that formula, how long has that been in place? And I guess when was the last tweak to that? Had there been before now that they're looking at? I find it really interesting.
I think maybe 20 years, I think.
Yeah, that sounds about right.
99 or so.
99, really? So in 99, those were wow. Okay. Well, I'm glad that is going away.
Well, we don't know if it's going away, but they are
looking at it.
So
evaluated.
So to that point, I guess over here on this side, this is ridiculous to me. Okay, it's just ridiculous. And so when I hear they're evaluating it, how do we push this? How do we for real get this to a place where, hey, this is going away? Like, what does that process look like?
They'll probably have to do more adequate and statistically significant studies to make a decision on if it's valid or not, and then use other factors. Because when they came up with this calculation, it was based off 3 very small studies, in the early 70s or so. You have to have a large number of people to study to make a generalization. And if you have a couple of hundred here, a couple of hundred here, that's not appropriate.
Got you. Okay.
For evidence-based practice.
Yep. Okay. I'm going to keep my eyes on that. That's really intriguing to me. Very much so. Thank you. I don't have anything else tonight. I have enjoyed this conversation. Definitely. I was stuttering a little bit, guys. I was fighting a migraine the last hour and a half. So that's why I was like, got all these lights and trying to just push through it. So I appreciate you guys so much for being here and just lending your time and your experience to this conversation. It is so important. And we don't, speak enough about kidney health, I believe, in the Black community. I was thinking about, Dr. Silas mentioned it earlier about how we all know someone, right? And, I actually put that in my sort of preview last night when I shot it out to social media. We all know someone, whether we know that they're going through it or not, we know that there is someone. And so what's the statistic? 1 out of every, do you guys know it?
I don't know.
What? It's 37 million people with kidney disease and 90% people don't know they have it.
Wait, say it again, please.
37 million people have kidney disease and 90% of the people don't know it.
90% of the 37 million do not know it?
Correct. Wow.
Okay.
That's a lot.
That's a whole lot. Wow. And so earlier, Nikeyia, I think you said that, normally we don't know unless we're stage 3, stage 4, or it's kind of, in a really kind of dire situation. In terms of our kidney health, is this a matter of just making sure every year we're getting our checkups, our physicals? Is there anything more specific than that we need to look into to get our kidneys checked?
Well, most definitely you want to make sure you have an annual physical exam by your healthcare provider because, like I said, blood pressure and kidney disease, they don't have any, symptoms in the beginning. And by the time you are symptomatic, some damage has been done. So my goal as a healthcare professional is to make sure we educate our community on these things because so many people have medical mistrust and they don't go to the doctor. And I've run into people who've said, every time I go to the doctor, they find something wrong. So I'm not going. Right. So, it's like, you go and you have high blood pressure. Okay, you do have high blood pressure. So, right. You don't address these things. And, and it's like, well, I feel fine. A lot of people say, well, how can these things be going on with me when I feel fine? Yeah. You may feel fine now, but you may not feel fine later as you have disease progression of whatever disease you have. So it's just about education, making sure people trust the healthcare system, and rightfully so. I mean, we know the different things that has happened to us throughout the years, with medicine. So we know they don't trust medicine. So we have to just make sure we try to educate our people. And as far as for kidney disease, there's risk factors. So if you have, diabetes, high blood pressure, someone who has end-stage kidney disease in your family, being overweight, being over the age of 60, those are all risk factors for kidney disease. As we age, our kidney function decline. These are things that you need to speak to your primary care provider about and making sure you're getting your lab work done and, stuff like that.
Can you talk a little bit about the need for staying hydrated? We know this, but can you talk about it? But most of us don't, and we do damage constantly by drinking things we shouldn't drink or whatever, the case may be. So can you lend your voice to that?
Well, of course you want to stay hydrated, but the misconception with kidney health is, I still go to the bathroom. I still make urine when your kidneys are right up there with your heart and lungs. Your kidneys do a lot more than make you, go to the bathroom. So of course it helps you eliminate waste and extra fluid, but it has an impact on our bone health. It helps our body make red blood cells. It helps control our blood pressure. There's a lot of things that our kidneys do that people are not aware of, and they don't know until they're not working anymore.
Wow. Okay. That piece right there, because I didn't know about the bone health aspect. Is that something that the kidney nurse, is that information that you also disseminate to the people that you're communicating with? Oh, that's awesome. That's really good.
I have a lot of things on my website, a lot of resources that Dr. Silas had mentioned, links to the National Kidney Foundation, links to the American Kidney Fund, just a lot of education. I'm not biased towards one organization because I work with them all, but just a centralized place where people can go to and try to get information to help them.
Awesome. Very, very good. Thank you. I'm going to look over here. I've got some comments. I have a friend who's a nurse from high school, from middle school. She says we were just talking about GFR at work and why the difference.
Wow.
Mm-hmm. GFR stands for
glomerular filtration rate.
See, your audience doesn't know that. Say it again, please. I was like, what? I'm looking at it like Grand Frank.
Basically, what we're talking about before is your kidney function. So
okay,
they were saying that blacks have more muscle mass than whites, and that's why they added the multiplier.
Okay, thank you. Good looking out, Aaron Ryan Hackle. Thank you for that. We've got some folks that are saying it's excellent and thanking you guys. Great discussion. Thank you guys. Good information. So I echo that, and I'm gonna wrap up here. I really appreciate it. I know I said it, and then I kind of went right back to you because something piqued my interest a bit. But I really appreciate you guys, your time, your efforts, your energy, your grace. Thank you so much, and I hope to have further conversations, maybe another time. Maybe we'll check back in some months down the road and see how things are going. All right. I appreciate you guys.
And remember, March is Kidney Month.
Say something about that.
March is Kidney Month. So what I do on my Facebook page is educate, people about kidney health and kidney disease. And then March 11th is World Kidney Day. So the theme is living well with kidney disease. So be looking out for that.
Thank you. And then April is, Erika, what is April again?
April is the National Donate Life Organ Donation. And so April is every year, it's something that we talk about in the community and really push organ donation. So, yeah.
So if I do have a viewer that is interested, maybe they haven't sort of align themselves with the school of thought that it's important to, donate. If they are finally getting to the place of like, you know what, I'm going to do that. The first step is what? What's the first step for that person?
They can go to giftoflife.org and it'll have all of the secretaries of state. You can connect with there. You could probably go to Michigan.gov and type in organ donation, and you can sign up either online or when you actually go into the Secretary of State, you can sign up. They've been trained to ask gift of life. Yeah.
Sorry.
actually, I'm sorry. It's gift of life Michigan.org.
Oh, okay. Let me fix that, guys.
And so they can sign up on the spot or they can sign up online.
Awesome. Very, very good. All right. We are wrapping up, guys. I'm going to just post this real quick so you can see it. It's Gift of Life Michigan. Is Michigan spelled out, Erika?
It is.
Okay. All right. I'm going to go ahead and put this here. And then we are going to say bye.
Motep.org, right?
What's that?
Is it just motep.org?
It's motep.org.
MOTTEP.org. And that's the minority education program part of Gift of Life.
Okay. So I'll just let that run here for a little bit. But we're finished, guys. So thanks for joining us. I've got someone that said, thank you so much for this. My husband is 4 years kidney cancer free. This was excellent information. Marlena, that's awesome. And I know Marlena, that's also like childhood friend. I had no idea. So I'm so glad that you shared that. Thank you so much for chiming in and being a part of the viewing audience and engaging with us. Got a lot of hearts right now and likes. That's good. Thank you so much, guys. All right. So there you go, guys. I'm going to let you go. The three of you hang behind for like a minute or two. And I'm ending it, guys. So next week, I will see you here again with Narrative Shifts. I believe we have some artists lined up. It's either artists or educators, but check us back out next week, 7:00. It'll be a fun show as well. All right. Take it easy. We will see you then. Bye.
Thank you.